Let's react to a video by P2 is the name. It's called My Hairline Surgery Went Completely Wrong.
So this basically all started with me just casually sweating, you know what I'm saying? I kind of expected that. If someone puts needles in your head, I'm expecting to be swollen for a little bit.
Pretty much, yeah. There's a trauma from the needles, and there's also the anesthetic that's being injected into the area. So that causes swelling that usually resolves after about a week post-hair transplant.
This was like, I'm not gonna lie, like the first or second day after the surgery. All right, so ladies and gentlemen, I just got back home. I was supposed to go on a date with a girl, but my face is swollen.
It's usually not a great idea to have a ton planned in that first week right after surgery. I always tell patients to just take it easy that first post-operative week, because that's when you're gonna experience the worst swelling and also just have some general discomfort and have some, bloody crusts. It's not something you really wanna be going on a date looking like.
I'm not really panicking.
Oh, somebody!
I'm not really panicking because the doctor said that your face is gonna swell up bad within like the first week, bro. Like, bro, look at me, bro.
Yeah, usually the swelling actually gets worse after about 2 to 3 days, and then it starts to slowly go away. So it looks like they went for a fairly straight hairline, which, many patients request. He has some temple work that was done, and overall they worked into at least the first inch of the hairline, and we'll see as we watch his starting point.
My head is so enlarged right now. Like, I have to wait for my head to really sink back in, because, yo, what?
Some patients ask me if it's a good idea to ice the area when they start to see it swollen. They basically want to do something about it, but the best thing is just to leave it alone and let it just subside by itself. You don't want to be putting too much onto the face, especially on the forehead, because your grafts are very close and you don't want to risk injuring the grafts and dislodging them. Also keep in mind that salty food is going to lead to potentially worse swelling, so you might want to avoid that, especially in the first 3 to 4 days post-op.
I look like those freaking, like, those things on Mario that go down like,
Well, the good thing is that if his date likes him in this condition, then hopefully that's a recipe for a nice long relationship.
I went to sleep that night just literally just watching Netflix, bro, enjoying my life, just happy about my hairline. Ain't no way it's normal, bro. Ain't no way you're literally telling me that this is normal. They messed up.
No, that's normal. Everyone swells to varying degrees. I have some patients who don't really mind the swelling and they basically don't even notice it after surgery, and then other patients who are really bothered by it. But regardless, after about a week, it's gone. Keep in mind that it's the hairline and the frontal scalp work that leads to that swelling that comes down the face. If you're getting work done more on the crown area, that swelling and that lymphatic drainage is going to go backwards along the back of your head, down the neck, and eventually it'll go into the neck where it drains, and you're not going to experience that type of swelling on the front of the face. So that's for work being done closer to the crown of the scalp.
This is like a cry for help, bro. Bro, who am I? My surgery went wrong, bro. They told me my face is gonna swell, but what is this? I don't even look like me, bro. Bro, look at my face. Hold on, bro. I gotta make a phone call, bro. I have a date tonight.
This guy is kind of like me in that if I make a plan, I'm gonna stick to it. Things have to be like really falling apart for me to not go through with plans that I've made. I don't like changing plans, as everyone close to me knows. So I get it. I get why he wants to keep this date.
I can't, bro. I can't be, bro. This can't be my last journey, bro. Bro, please.
Your face look like a flat tire.
You're supposed to be in support, bro. Like, support me, bro.
Okay.
Yeah, after surgery, you definitely want to surround yourself with people who can be understanding and empathetic to what you've been through. It's very easy to just look at someone after a procedure, especially in the first week, and say, oh, you were botched, oh, something terrible happened to you. But yeah, you don't want to talk to people who might tell you that. So also, if you're concerned, it's always best to just call the clinic, call your surgeon. Hopefully they've given him a phone number that he can easily, dial and talk to somebody, or send an email, send a photo, and see if what he's experiencing is normal or if there's something to actually be concerned about.
One good thing I can say about you, bro, is that I don't think you look bad being bald.
I don't think he wants to hear that after a hair transplant.
I think in the long run, you'll be good. That's a pro. Like, in the long run, you'll be all right. Right now, I think you just gotta go through what you're going through. And regardless, if she doesn't like you, bro, right now, I don't think she's for you for the future.
That's some good advice right there. I also, though, wouldn't have scheduled it this way. I think the date could wait another week.
I gotta go, bro.
No, don't leave.
I mean, I'm not sure if he's joking here. I mean, definitely some part of this I think is just him having fun. In all honesty, I mean, people do sometimes have a tough time with recovery after any type of surgery, you know, especially an aesthetic procedure where you went in like healthy, you know, you looked pretty normal and you were looking for an enhancement. And yet there's this recovery period. So some patients really struggle with that, whether it's from a hair transplant or a facelift or a rhinoplasty. It takes time to start to look more normal again and hopefully a better version of yourself, or at least closer to the goal that you were hoping for. And that's a process, you know, that definitely is a process.
Sorry.
They're very dramatic. Again, the best thing to do is to just call the doctor and make sure that what you're experiencing is normal, you know, and that will hopefully allay some fears.
I have a date tonight on stream, bro.
Well, again, if there are any concerns like that, like from the surgeon's perspective, I'd like to know if my patient is super concerned. And, you know, I get that. In the first week especially, I have some patients who are overly concerned. They're very worried. They think that, you know, especially with their swollen look, that's the final result, that they're worried about the hairline positioning. Did we follow the markings? Did we not? It's hard to tell because everything is swollen. So the best thing that you can do is wait and just be patient and really trust your surgeon. I mean, you trusted them or the clinic, but ideally your specific surgeon, right? That's who did your surgery, or at least was fully responsible for the surgery. And trust that they will guide you through the recovery. Don't just trust them to do the surgery and then cross them off. You know, I mean, stick with them, have them guide you through the recovery. And stress is never good for post-op recovery, or really ever. So it's best to try to limit those stressful moments. And even if I can't tell if he's joking around here or not. Even if he is joking around, he should probably just bring that energy level down because he's recovering, and you want to be in the best possible state so that tissues survive and the grafts do well and that you have nice, healthy regrowth. It's also good to potentially bring someone with you if you're traveling for surgery. You're going to be staying, you're away from home. Not a bad idea to just bring someone with you so they can help you out. You know, if he, let's say, doesn't want to go out looking like that for dinner, he can maybe have someone bring something in for him, and just to travel home, to have a buddy, to have a family member with you, to have a friend with you. I mean, I think that's a helpful thing.
Oh my God, bro.
And some people at a time like this, they start regretting ever having had the surgery. And maybe he's thinking about that at this time. See, this is very common for people to take ice and try to reduce that swelling. And as good as that ice might feel, it actually doesn't tend to speed up the recovery of the swelling, specifically swelling that occurs after hair transplant. As he goes to like wipe his eye, you know, of the tears or whatever, just to wipe his eye, he's pretty close to the grafts along the temple, so he has to be really careful. You don't want to dislodge them on day 2 or 3. It takes about 72 hours for the grafts to really anchor in and for it to be difficult to then dislodge them. But at this time point, they're vulnerable. So anytime that you look to raise your arms up and put them anywhere close to the face, it's best to be in front of a mirror so you can be careful and know if you're too close to the grafts.
Let me see.
Bro, laugh, bro. Please, bro.
I ain't laughing, bro. Something got in my nose. Wait. Let me see your other eye. Bro, what happened?
Bro, I have a date. Bro, I have a date in a couple hours, bro.
Nah, you gotta cancel that date.
I'm not canceling.
He now has like 3 friends who told him to cancel the date, but maybe this date is just too important to him.
But look what people are saying. My cousins, he has the same last name. Obi-Wan and Nawali. Wait, is this real? What's up with your face, bro? When I was in surgery, they put needles in my head and I went to sleep, bro.
Oh, he went to sleep. That's interesting. So does he mean that he actually had like IV sedation or general anesthesia for his hair transplant? Or does he mean that he just was sleepy? Maybe they gave him some like Ambien or Valium that made him sleepy, but it's unlikely that the actual injections put him to sleep. But perhaps they did give him some propofol or something else to give him some sedation in addition to the IV sedation, and maybe even in addition to the oral sedation.
Did I get cloned? Did I get cloned when I was sleeping?
People feel that certain celebrities have been cloned, or just certain people in general. I see that as like a frequent comment on my videos, and I'm like, no, I don't think that's the case at all. I don't think our technology is quite there to clone humans, and I don't think we're doing it on a regular basis. Maybe the technology is there, but I don't think that anyone has been cloned, or have they?
I'm getting balloons for my date. I have a Valentine's Day. Hello? Balloon? Hola? Hola? Balloon? Red balloon?
Does he think that the name of the person who runs the balloon shop is Balloon? That would be funny, actually. What a coincidence that would be.
Yes, yes, yes. Thank you so much, okay? Thank you. Have a great one. All right. She believed in me, bro. She believed in me, so we gotta lock in.
Again, with putting on the shades, he has to be careful with those grafts right by the temple. So they're very close. And in all seriousness, you have to be super careful because it's very easy to brush those grafts out, and then you have to get another transplant to get them back.
I don't care about the swollen face. I know I'm a sex symbol, bro. I'm about to call a female right now.
I mean, the swelling isn't that obvious if you've never seen like his before image or video. So maybe they won't notice.
What's good?
Evan. Oh, I thought his face is literally. Did he get beat up?
I ain't get beat up. I just cut my hair.
Looking like some. I don't want to be alone.
I thought this was going to be a little bit more about his actual surgery. Oops. But I'm dying to see if he actually goes on this date.
I'm getting a haircut on stream and I'm having a date, bro.
Well, it's a little bit too soon to get a haircut. And, you know, he just had a surgery like 2 or 3 days ago. So I usually recommend waiting about 3 weeks before getting a haircut at the recipient area. For the donor, you can get it faded in after about 5 days. But if you're looking to have anything cut around the or shaved around the recipient area, it's best to wait closer to like 3 weeks from after surgery. So he's definitely too, close to his surgical date to get a haircut. And I'm not really sure what they would even cut. They kind of shaved him down for surgery.
This is gonna be a special day. I have my balloons in the air. Nothing is ruining my day. Y'all can laugh all you want, bro. Laugh at the screen. I don't care. I'm not cooked. No matter what you guys think, bro.
His date, I don't know if his date actually happened. Good luck, P2.